Okay, we're gonna keep going with the muscles. So we got down through latissimus yesterday, so now we're gonna go on to the deltoids. So the deltoids, I'll ask my patient to sit up real straight. And the deltoid is this whole upper shoulder muscle right here. So we're gonna divide this out into the anterior deltoid, the middle deltoid, and the posterior, okay? So the whole muscle has the same origin, the same insertion, the same innervation, but different sections of it have different actions. So if we look at the whole deltoid, its main job is to abduct the shoulder, abduct the arm, okay? That is the same action that the middle deltoid will do. So these middle fibers are going to be right underneath the acromion process, and it's going to be the part of the deltoid that is directly on the patient's side, okay? So I'll palpate there, and I'll ask my patient, can you raise your arm out, flap your arm like a chicken? Okay, put it down for me. Okay, now press out into me, raise up your elbow, there you go. No. Like that.
Oh, I'm sorry.
That's okay, just press into me. Excellent. Okay, now the reason I add the resistance, okay, I can feel it. Go ahead and do your arm out like that again. Okay, I can feel that. Relax. But while you're first learning, sometimes having the patient move makes it a little bit harder to figure out what you're feeling. So if I add resistance, do the same motion again, I take out the movement, and now I can really just concentrate on what my fingers are feeling. Also usually get a stronger contraction. So the muscle is gonna contract a little bit harder and again be easier to feel, okay? When I'm looking at the anterior deltoid, okay, it's gonna be the front of the shoulder. Make sure this is the axillary line, this is the line between the chest and the armpit. Make sure you're not over here on the chest. Make sure you're actually on the front of the shoulder, okay? Now the anterior fibers, they flex the shoulder. So can you push into my hand for me? Awesome, okay? So he is trying to push up and I'm not letting him, okay? So that's shoulder flexion. Now posterior deltoid is gonna be back at the back of the shoulder. Again, make sure you're not over here, okay? This is the line, his axillary line. Make sure you're actually on the back of the shoulder. And what I want you to do, patient, is push backward just like that. Go ahead. And he pushes into me and I can feel these fibers tightening very nicely. Okay, so that is the deltoid, anterior fibers, middle fibers, and posterior fibers. Okay, let me move this. And patient, if you'll lay down on your back for me. Even give you a pillow.
Wow.
I know, it's special. Okay, so now we're gonna look at the pectoralis major. Huge muscle. Pec major comes across and it inserts on the lateral lip of the intercondylar groove. So if you remember, lovely lady lat lies on the floor between two majors. This is one of the majors that she's lying between. Okay. If we look at pec major, all of it, whole thing, its main job is to, you can relax, is to adduct the arm, pull it to your side, or to horizontally adduct the arm. Okay, either one of those actions will be fine, and you can palpate anywhere between right under the clavicle, okay, to right about the nipple line. So you've got this whole square right here that you can palpate. Anywhere in there, you would be on pec major. I could put my finger there and squeeze your arm into your side for me. Excellent, and I feel that tighten up, okay? Some different fibers of pec major do different actions, okay? If we're looking at the superior fibers of pec major, those fibers, the way they're angled, they help flex the arm, okay? That's the only part of pec major that does that, is these superior fibers. So they're found right underneath the clavicle. So here's my patient's clavicle. So I'd be just right underneath it, and I would ask my patient to raise your arm up in the air. Perfect, he did. I felt that tighten. Again, if movement was bothering me, I could ask him press up into my hand. Excellent. If he had no shirt on or even a tank, you would actually see that muscle fire. Okay?
I will not do that.
No, you don't have to do that. Okay, now we're gonna do lower fibers. Lower fibers are really cool. Lower fibers of pec major help you extend your arm from a flexed position, okay? So first thing you need to do is have the patient flex their arm. Just like that, okay? Now, lower fibers are gonna help him force his arm down, okay? So you have to give some resistance, and where your hand is gonna be is you're gonna be on the lower half. So usually I recommend being right about the nipple line and just come a little bit medial, okay? Now on a gentleman, you could be anywhere in here. On a female, that's gonna be weird, okay? On a female, I highly recommend you stay as close to the sternum as you possibly can, but again, lower down kind of towards the nipple line, okay? So my patient's gonna have his arm up here, and I'm gonna ask him push down towards the table. Excellent, okay? When he does that, I can feel these lower fibers tighten up, okay? So again, if I asked you on a skill check to do pec major all fibers, you could be anywhere in there, and you could ask the patient to adduct or horizontally adduct their arm, and pretty much all of pec is gonna fire. If on a skill check I asked you about superior fibers, you would be right under the clavicle, and you would ask your patient to flex their arm. If I asked you for lower fibers or inferior fibers, you are going to be nipple line close to the sternum, and your patient's arm will be flexed, and you'll be asking them to force their arm down against resistance. Okay, we just have one more for this video, and it's gonna be pec minor. So if my patient can sit up for me.
Can indeed.
Thank you so much. Okay, make sure I didn't miss any. We did deltoids, we did pec major, and pec minor. That's awesome. Okay, bring your legs down right here for me. So for pec minor inserts at the coracoid process. So we're gonna get a little bit of practice with coracoid process. So pec minor is coming off the ribs, and it's coming up and inserting right here. So I'm going to find my patient's coracoid process. And then pec minor, what it does is it downwardly rotates the scapula. So if you remember with the rhomboids, to get the scapula to downwardly rotate, we had the patient put their hand on their back and lift their hand away from their back. We're gonna ask our patient to do exactly the same thing. So patient sitting up real tall, can you put your hand on your back? Just one is fine. Well, this one, because that's the one I'm feeling.
You didn't specify.
I didn't, you're right. Sit up real straight and try to raise your hand away from your back.
Wait, I'm not sure I understand.
Like that.
Ah.
Okay, excellent. And I can feel that, and I can actually feel it going in this direction. It's like a little rope right there. Cool. Okay, that's pec minor. Thank you.